dietitians, supervisors, relatives, friends, family, and spouses. They are referred to as narcissists, and any relationship with them is generally extremely toxic. In today's episode, we'll analyze the complexities of this very challenging personality disorder, as well as answer your questions on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Buxani-Mirpuri, a licensed mental health counselor. Today's first question comes from Francine, who just reached out from our allhealthtv.com website. Welcome, Francine. Hi, Dr. Buxani. I was talking to my coworker Maggie last week about our obnoxious boss, and she referred to him as a narcissist. I pretended that I knew what she was talking about, but what exactly is a narcissist? Francine, great question, great start to the show. Before I take your question and answer it, though, we have a wonderful video from Cleveland Clinic that I want you and our viewers to watch.
While we may call someone a narcissist to describe someone who acts self-absorbed, narcissistic personality disorder is actually a serious condition that can affect how you see yourself and how you relate to others. If you know where to look, there are some telling traits of NPD that stand out. 1. An overinflated sense of self-importance. People with NPD often see themselves as the most important person in the room. They prioritize their ideas above others, insert themselves into the center of every conversation, and tend to exhibit issues with control when things get tough. This desire for perfectionism can damage relationships with others, but it can also cause undue stress on their own emotional and mental well-being when situations don't work out the way they envisioned.
I hope this video helped start the conversation of what this extremely challenging disorder is about. Let's talk about narcissistic personality disorder, or NPD. According to the Diagnostic and Statistical Manual, these are the symptoms of NPD. 1, the grandiose sense of self-importance. These people literally believe that the world revolves around them. And it's a result of them coming from backgrounds where maybe they've been treated like that, or being a golden child, which we'll talk about in a little bit. But that sense of self-importance, the way it plays out is that they feel that they're extremely deserving, a sense of superiority, and a constant need of admiration and validation from everybody around them, or what we call the narcissistic supply. So the narcissist really has people in their lives to be able to give them or provide them with that narcissistic supply. The next point, the point number 5, which is a sense of entitlement, is probably one of the most important characteristics of a narcissist, really what sets them apart, because the narcissist really believes that they are better than everybody else, which means that I am entitled to everything that nobody else is entitled to, right? So that sense of entitlement can really be detrimental and hurtful in relationships. Point number 6 is the willingness to exploit others. Really hard to understand that, but a narcissist, and especially a person with narcissistic personality disorder, will go through any lens really to get their way. If that means inconveniencing somebody, if that means using somebody to their own benefit, they will do that and not feel any which way about it, which leads us to point number 7, which is the lack of empathy. This is confusing, and I'm going to take a few minutes to explain this, because most people think that people with NPD do not have empathy. That's not true. What they have is a different kind of empathy, right? So when we talk about empathy, we talk about different kinds of empathy. So there's cognitive empathy, which is, I'm watching a video, a sad video, and I know that I should feel sad about this because it's a sad video, right? So that's cognitive empathy. People with narcissistic personality disorder actually have cognitive empathy. The next level of empathy is emotional empathy, where I can actually feel bad for the other person. I feel sad for what they're going through. I'm kind of feeling their emotions. They don't have that. So people with NPD do not have emotional empathy. And the highest form of empathy, which is compassionate empathy, which is I feel bad for the person, but I also want to go out there and help this person. I want to do something to make it better. Of course, our people with NPD do not have that. But they've replaced these two, the emotional and compassionate empathy, with two other forms of empathy. One is performance empathy. If they're willing to exploit people, remember, they are good at that. So if they feel that I need to perform this empathy to be able to get what I need, they will do that, right? And they have another form of empathy that's called a transactional empathy, which means, okay, I'm going to do this. If I need to be empathetic because I need something back in return, I'm going to go ahead and do that. The last and not the least is a very detrimental sense of arrogance that people with NPD have that's almost impossible to tolerate in many circumstances. I hope I've answered your question, Francie. Thank you for sending it in. We have our next question from Stan. Stan asks, Dr. Buxani, can narcissistic traits be present in someone without having a full-blown personality disorder? I absolutely love this question, Stan. Thank you for sending it in, because here's the thing. Most people who have narcissism are not actually diagnosed with NPD, because guess what? The DSM, along with giving us the symptoms, also tells us that the only way to give a diagnosis to the person is if there's social and occupational impairment. And guess what? Most narcissists, they're going on with life feeling everything is great because they're using other people, getting exactly what they want. They're full of themselves. They don't really feel that there's a problem with them. Thus, they don't come into therapy, and thus, they don't get diagnosed. So really, a lot of people actually have narcissism or narcissistic traits and not the full-blown disorder. Hope I answered that, Stan, and thank you for sending in your question. Let's move on to our next question. It's from Min, and Min writes to us from Facebook. Dr. Buxani, my son Yoshi is best friends with our next door neighbor's boy, Randy. Maybe it's me, but he's very self-confident, bordering on arrogant. My question is this: how can you differentiate between healthy self-confidence and narcissistic behavior? Again, I love your questions, guys. Please keep it coming. Healthy self-confidence. If I had to answer this question in one sentence, this is what I have to say. A person with self-confidence thinks they are good. A person with narcissism thinks they are better than everybody else, right? So it's almost that nobody else stands a chance against me. I am better than everybody else. A person with healthy self-confidence does not feel the need of tearing somebody else down like the narcissist does not feel that they need to broadcast their achievements like the narcissist does to get the narcissistic supply, and does not feel the constant need for admiration and validation as a narcissist does. A person with a healthy self-confidence is just fulfilled within themselves. Hope that answers your question. In case you missed it the first time, here's another opportunity for you to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
we have our first Instagram question of the day, and it comes to us from Grayson. Hey doc, I just started dating this woman I met about a month ago at a singles event, and I'm crazy about her. But my best friend Hank isn't her biggest fan and says she's pretty narcissistic. If he's right, and I'm not saying that he is, what impact can narcissism have on a relationship? Wow. Grayson, I'm going to answer this question by actually walking you through the relationship cycle with a narcissist. And I'm sure that will give you an in-depth understanding of if she is a narcissist, what you're in for. All right, the relationship of a narcissist with the narcissist begins with the idealization and seduction phase. Oh my gosh, this is all rainbows and flowers and ponies. This person is giving me everything that I want. They are placing me on a pedestal. Oh my gosh, I urge every person out there not to want to be on a pedestal because the fall is greater. But that's what it feels like when you first get into a relationship with a narcissist, because it's all about you. Their world seems like revolves around you, and it feels great. Now, in about 6 weeks to 4 months, when they feel that they've kind of hooked you on, they've got enough information, it's almost like a detective, they've got every piece of information on you, and they've earned your trust, then they move on to the second phase, which is the devaluing. It's a very hurtful phase because what they've done at this point is they've taken you from the pedestal and thrown you right on the floor. Everything that you've ever told them in confidence, maybe your vulnerabilities that you've shared with them, that's what they're going to take out and throw on your face every time they get upset or they get triggered or they get enraged. This is also where gaslighting comes in. And it's important for us to understand the concept of gaslighting. So gaslighting for many people is like, okay, but it sounds like lies. It sounds like the person is lying. No, not really. So let me give you an example, right? So a person who is lying would say, if I say I'm wearing a green top, would say, no, that's purple. And I would say, no, that's green. So you're denying my reality, and really you're just lying. What a person who's gaslighting does is says, no, that top is purple, and are you okay? It seems like there's something wrong with you. You need to go and get yourself checked. Oh my God, like you look, like, are you tired? Are you sick? Is there something wrong with you? So they actually dismantle the whole person because they make the other person feel that there's something wrong with them. And that happens during the devaluing phase, where you're left questioning yourself about everything, right? From the devaluing phase, we move into the third phase, which is the discarding phase. At that point, the narcissist is done with you. They're like, okay, you hold no value to me. I'm done with you. Out you go, right? I'm not going to give you that importance. Like whatever supply I needed from you, we're done. Okay. Again, a very hurtful phase. And then comes hoovering. Hoovering comes only when the narcissist feels like maybe they've gone out there, maybe they've tried other people, they're not getting their narcissistic supply, now they want you back into their life, and they try to hoover you back. So now comes back the, oh my gosh, but look, I'll go into therapy, I'm going to become this better person for you, it's all going to be okay, trust me, we need to be together, please come back to me, right? So that's the hoovering phase, and we tend to believe them because a big part about narcissistic personality is they're quite manipulative. And so it's easy to believe what they're saying. So those are the phases. Aside from that, there's a concept of trauma bonding that happens in relationships with narcissists, which is, because the first part is so good, the idealization of love bombing phase, as we call it, is so good. When you get to the devaluing phase, you almost feel like, oh my gosh, I'm going to do everything to get back to that place. It felt so good to be there. And that that whole cycle creates this trauma bondedness where every time you're on the devaluing, you're trying to get back to that good place. And you really do lose your whole sense of self and your whole sense of identity to be a part of this one relationship? I hope, in brief, I was able to answer that question for you, and all the best. Let's move on. And let's see, our next question comes to us from Rochelle, who's reached out to us from YouTube. Dr. Buxani, first things first, my real name is not Rochelle. I don't want my husband finding out about my outreach. I'm 95% sure that he's a narcissist because he checks many of the boxes. I'd like to know what are some effective strategies for managing relationships with a narcissist. Rochelle, my heart goes out to you. I understand just how difficult of a spot you are in. I'm going to try my level best to give you some tips that are going to help you along the way. Let's talk about some strategies. First thing, please educate yourself. What psychoeducation does with a therapist or otherwise is it gives you the ability to have realistic expectations, because you need to be guided by realistic expectations when you're in a relationship like that. The second point, work on radical acceptance. I cannot emphasize the importance of radical acceptance, not only acceptance, but radical acceptance, because I want you to know that it's not going to change. The cycle of the narcissistic relationship does not change. The situation does not change. So, understanding it gives you some strength to be in it. Learn the technique of deep. Don't go deep, right? What does deep mean? And this is a technique that I have to credit Dr. Ramani for, because I think it's wonderful. And the acronym for deep is don't defend, don't engage, don't explain, and don't personalize. Easier said than done, I understand, because you're in a romantic relationship. But as much as you can, not engage and not defend, it's going to be helpful to you. And lastly, please surround yourself with empowering people who can lift you up in those times when you've had maybe a moment of rage from your partner, or maybe a really devaluing moment. So please reach out to people who are going to be on your team. Thank you, Rochelle, for sending your question in. Let's move on. We have our next question from Facebook and Carlos. Hi, Dr. Buxani. I was initially reticent to write in and share my story, but I'm hoping that knowledge is power. It absolutely is. Carlos, I hate to say it, but my brother is a classic narcissist, and it's having a detrimental effect on me and the rest of my family. How can friends and family members maintain their own mental health while dealing with a narcissist? Carlos, again, I am so sorry you found yourself in a situation like that. It is definitely not easy, and really all strength to you. How do you take care of yourself? Very important question. I'm glad you asked it. One of the things I always tell my clients who have family members who they can't avoid and they have interactions with is, listen, every time you have one of those very detrimental, toxic encounters with your family members, please engage in self-care for the next couple of days. Give yourself love, show yourself compassion in those moments where you've just had such a toxic encounter with your family member. If you can, please follow the deep. So don't go deep. Don't engage. Don't try to keep it very superficial. Talk about the weather. Talk about things that are absolutely meaningless, because the minute you engage in something that is emotional, that might trigger them, and then we're going to go down a spiral. Again, my heart goes out to you, and please hang in there. Hope you get all the strength to deal with what I consider to be one of the most difficult situations. If you've got questions, we've got answers. And just in case you missed it the first couple of times, here's another chance for you to find out where to send your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
It's time to take a question from Wei, who asks, Hi, Dr. Buxani. I'm studying to become a LCSW. Yay! Wei, congratulations. And I'm wondering if there are any specific therapeutic interventions or techniques that work well with narcissistic clients. Wei, first of all, congratulations and thank you for wanting to engage and work with narcissistic clients because, well, most don't. So thank you for that. Let's talk about specific strategies. If there are, one, get them engaged. Even if that means letting them be a little grandiose for some time, go along with it because that will at least get them to begin to trust you, right? Help them with the things that they find most challenging, which are help them with emotional regulation. We have wonderful mindfulness techniques that we can teach our narcissistic clients for when they get into that shame rage cycle. Because remember, when narcissists feel shame, they react with rage. Okay, so what you want to do is help them, give them techniques to emotionally regulate. Help them with the skills that they find really hard, which is one, self-reflection, right? Because they lack the ability to reflect upon what their actions are, what their feelings are, what their thoughts are. So help them develop skills to be able to self-reflect and accurately self-appraise, because that's the other problem with narcissists, right? That whole sense of grandiosity comes from an inability to accurately self-appraise. So giving them that, but remember, it's a push and pull. Okay, you can't go in and tell them, okay, but what you're thinking is wrong. You need to change that. That's not how you're going to approach this. So there's going to be a little give and take, push and pull with that. Now, in addition, what you want to do is come from a trauma-informed background, because what we do know is, of course, people with narcissism have had traumatic upbringings, in most cases, not all, but in most cases. So you want to come from a trauma-informed background, and please, Veve, take care of yourself. Be vigilant about transference. If you feel triggered, if you're in a session with a very antagonistic narcissist, please get supervision, take care of yourself, and reach out to colleagues who can, give you the strength to be in that therapeutic relationship with them. Thank you, Wei, for that excellent question. Let's move on. We now have Frida from YouTube. Hey, Doc, I watched a movie on one of the streamers last week about a boy raised in a dysfunctional home who grew up to become a sociopath. Can negative childhood experiences really contribute to the development of narcissistic traits? Absolutely. Frida, thank you for your question and touching upon the nurture versus nature. But yes, absolutely. There is, so if I had to really do this, I would take the genetic predisposition that one has, the temperament of the child when born, and the negative childhood experiences, the invalidating childhood experiences, including abuse, neglect, and I would put them all in a blender, blend them all together, and that's when we have a person with narcissistic or other detrimental personality disorders. So absolutely, adverse childhood experiences can play a huge role in the outcome of a person with a personality disorder. We've got another question from AllHealthTV.com. Let's go into that. Elon, thank you very much for writing in. Dr. Buxani, what are some misconceptions about narcissism? Yay! Great question, Elon. I'm so glad you talked about that. And in the world of TikTok and Instagram and everybody's talking about everything, I am so glad you asked this question because there are a lot of misconceptions with regards to narcissism, but I'm going to touch upon a key one. And here's the thing. The key factor about, the misconception is that narcissism in all people looks the same, which means that everybody has that grandiose sort of outlook. Not really, because we forget that there is another kind of narcissism, which is a vulnerable narcissist, which is the, oh, woe me, pity me, feel bad for me, but they still have a very deep sense of entitlement. What they want is the world to feel bad for them, but still revolve around them, right? Like do everything for them. So that, I hope, explains one of the very, very important misconceptions that we have around narcissism. I hope with all your questions today, I've been able to give you a little clarity on this extremely, extremely difficult and challenging personality disorder. That's all the time that we have for today. Please take care of yourselves, take care of your relationships, make sure you're in healthy and untoxic relationships. I am Dr. Rachna Buxani-Mirpuri, and we will see you next time on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.